All right, guys. So today I want to show you guys what arthritis and degeneration looks like on an x-ray. And we will look at a neck specifically for this. So obviously this is the view of a person's neck. Now normally we should have a nice curve in our neck, and that's what this green line is. So we should have this nice healthy C-shaped curve to the neck, and right away we could see that this person is starting to lose that curve, which was one of the many reasons why our neck starts to degenerate in the first place. So we could see the general alignment is off, and right away let's take a look at this segment by segment so we could see here. So up at this top arrow, we could kind of see this vertebra right here looks very nice. And the vertebra right below it looks pretty good as well. And then this disc space is nice and opened up. We don't see any signs of degeneration, no bone spurs. It's looking really good. And then as we work our way down a little bit, we can see that a couple segments here we're having some bone spurs coming off the front of those vertebra, and we can also see that those disc spaces, specifically there and there, they're a little bit narrowed. Now, how did it get like that? Well, when we have dysfunction in one or more of these joints, meaning that there's improper motion or lack of motion, when we get to wearing out those discs and inflammation comes in, and the vertebra responds by building these spurs to stabilize the area. Now these are similar to cavities that we get in our teeth, right? And many times people go to the dentist, and it's not necessarily because they have a toothache, but the dentist could find some of these cavities. And similar to our office, people come into our office and they have this kind of degeneration going on in the neck, but they don't necessarily have neck pain. And kind of just like those cavities, if we don't address it and fix it, then most likely it will lead to symptoms down the road, very similar to these cavities of the neck, right? So what we do is we kind of encourage motion into those joints and put them in better alignment so that the person can function better, and then stop compensating in other areas of the spine.